All righty, town meeting talk show time here on Monday, the 1st of June, a new month. What will it have in store for us? We've had COVID, we've had murder hornets, we've had cannibal rats. Will there be locusts, dogs and cats living together, mass hysteria? I don't know. What I do know is that today I get to let state officials do most of the heavy lifting on this program. Our primary purpose here this morning is to share with you the extra press conference excerpts from it that was held last night in reaction to a pretty big jump in the discovery of COVID cases. And while that is a significantly larger number than we've been hearing, there are some sort of, would you say, extenuating circumstances or what? There are some reasons for the jump. In the short form, a cluster of cases in one particular facility in Anchorage. I think 12 of their 15. And then also the reason for the growth in cases in Kenai, according to Dr. Zink, as you'll hear, has to do with what they were calling large gatherings. And I don't know if that means graduation celebrations or what. Maybe lots of people fishing. They weren't real specific about it. But so it's not like it's just kind of willy-nilly widespread across the state. There are particular trouble areas. But you'll hear what they had to say. And I want to bring back into current thought some announcements made at the end of the week, last week here in Cordova, that are relevant to today, June 1st, regarding testing and the reopening of playgrounds. First off, though, thanks to Cordova Wireless Communications for the sponsorship of this show and the financial support that they provide for the community, really, because of all those outside dollars they're able to bring in. All the money we spend with them stays in town and does not feed larger companies outside of Cordova. So it's a lot of economic benefit. And we appreciate their sponsorship of this show so we can do that. So let's talk about some local stuff, then we'll get into this press conference. First off, the change in the schedule for the local free drive-up testing. It's still available every day with the shared responsibility between the Yelonka Clinic and CCMC, but they have altered the time slots, presumably to be better suited to the needs of when people are available. Remember, it was 2 to 4 each day at both facilities. Now what's going to happen is on Mondays and Wednesdays, it's still Yelonka Community Health Center downstairs across from the Episcopal Church, but instead of 2 to 4, they're going to do their testing from 1 p.m. to 3 p.m. So it's shifted earlier by 1 hour. So if you want to go in for free testing today, you would work with Yelonka, call ahead to them at 3622 and do that quick pre-registration, which saves you time. And then on Tuesdays, Thursdays, and Fridays, CCMC is going to start working in the morning, 9 a.m. to 10 a.m. in the ambulance bay. And their number is 8,000 to call ahead and pre-register. Still, if you are not able to access these times, the two facilities are willing to make arrangements to accommodate your schedule. Obviously, they have a lot of general work to do in general health care. So I would imagine, and this is just me speculating, I would imagine that they would prefer that you use those windows if you can, but if you can't, it sounds like they're more than happy to accommodate you. So the new schedule, again, is Yelonka free testing, drive-up testing in Yelonka from 1 p.m. to 3 p.m. on Monday and Wednesday. And then at CCMC, Tuesday, Thursday, and Friday, it's 9 a.m. to 10 a.m. And that's effective today. Also effective today, unless plans changed and I didn't hear about it, the Cordova Parks and Rec Department is pleased to announce the reopening of playgrounds, the Knoll Palace Children's Memorial Park and the Mount Echols Playground. Now, they emphasize, just like Sometimes a pool doesn't have a lifeguard and everybody needs to be responsible for themselves and their own kids. The use of these playgrounds is the same thing with regard to COVID-19. It's at your own risk, and each family or small group needs to be responsible for preventative measures. The Knoll Palace Park will have hand washing available on site in the Snack Shack bathrooms. The Mount Echols Playground, though, will not have hand washing on site, and there's no indoor public access to the school, so you need to come prepared with your own wipes and your own sanitizer and that kind of thing. Now, Parks and Rec is emphasizing that they need our help to keep the kids safe, so wash hands prior to and after visiting the playground. Come prepared with your own hand sanitizer or hand wipes. Please stay home if you or a household member is sick. Don't bring sick kids to the playgrounds. Caregivers and parents, please don't come to the playgrounds if you're sick with your kids. Continue to practice social distancing, at least 6 feet of distance between anybody that's not in your household or one of these what's called social bubbles now. And keep in mind, too, that if things go sideways, access to the playgrounds could end up being limited or restricted without notice based on future health risks and scenarios in the city. So it's one of those things, again, that as long as we do a good job managing ourselves and our families, we should be fine. But if we ignore the guidance with masks or social distancing, all those things, if we ignore that and end up with an outbreak, then things will close back down again, pretty much certainly. So that's what's new today. Now let's get into this press conference. This was held last night in reaction to the announcement of 27 new cases in Alaska in the prior 24-hour sampling period. And it starts with Governor Dunleavy.
Good afternoon, Alaska. Thanks for being part of this Sunday presser. This is a special press conference we're having today. And the reason we're having the conference today is because we've had a number increase in the number of cases. So today, we have 27 new cases over the 24-hour period. And as we've talked about over countless press conferences and press releases, we want to keep the public informed. This is going to be an opportunity for the press to ask questions and talk about what we're thinking, what we're seeing in light of the fact that we are opening up our economy. We're going to keep moving in that direction because, once again, we believe that we will have a handle on this. We'll be able to manage the cases as we go forward. We will keep an eye on things. We still believe that a caseload of 27 is manageable, given our healthcare capacity. We're going to talk today about some of the details of these cases. Today we have Dr. Zink with us as well. We have Dr. Michael Bernstein, Chief Medical Officer for Providence Health, and Natasha Paneva, Director of the Anchorage Health Department, is here too to talk about Anchorage-specific cases. And as you know, oftentimes Anchorage, the city of Anchorage, has their own press conferences, but given today is a Sunday, and we wanted to get folks together. So again, we have the opportunity to address Alaskans, but also get the press in one spot along with folks that can talk about these cases. But again, so we have 27 cases, total of 460 cases. New deaths, 0. Total deaths at 10. Cumulative hospitalizations, 47 still. Total recovered, 368. Total tests administered, 53,063. Current hospitalized, 10, which is a decrease of 4 since Friday. So that helps our capacity. And so we still have nearly 900 beds available. But again, we want to be able to talk about these cases because as we continue to move forward and manage this pandemic in light of opening up our businesses, we're talking about, we'll be talking all this week about the details in the revisions to the 14-day quarantine for folks coming into the state of Alaska. We thought it was important that we get out ahead of this and be able to once again engage Alaskans and engage the press in these cases. Keep in mind, weeks, if not months ago, we did have days where we'd have 16 cases and 17 cases. We kind of gotten used to some days with 0, some days with 1 or 2, 3 or 4. So again, we don't see this as any reason to get overly concerned. We said we're going to watch this every day, which we're doing. Had conversations yesterday about the caseload. We'll continue to have conversations every day and monitor it carefully. So again, I just want to assure Alaskans that State of Alaska officials and others in the State of Alaska, municipalities, other entities, we're all working together. We're on top of this, and we'll keep you informed. Again, if we see something really kind of going sideways, we will have a press conference, we'll have that discussion, and we'll engage Alaskans in it. And so with that, Dr. Zink, if you can talk about the cases, and then after Dr. Zink will pass it on to Dr. Bernstein, and then we'll pass it on to Natasha Pineva with the Director of Anchorage Health to talk about Anchorage. And then we'll go to questions from the press, and we'll answer any and all questions we can, and then conclude the press conference. So again, thanks for assembling here on a Sunday afternoon, short notice. But again, we want to talk about these cases, these case numbers, so that we can assure Alaskans that we're on it, things are going to be fine, and we're going to keep moving forward. So with that, Dr. Zink.
Yeah, thanks, Governor, and good Sunday afternoon to everyone in Alaska. Appreciate the time tuning in with some updates on the cases. So a couple slides to just continue to provide information. So as the governor mentioned, 27 new cases today for a total of 460. We also have one additional non-resident case. Some people may have noticed that the non-resident case did jump 2 additional spots, even though we only have one non-resident case. And that's because on a further interview, what appeared to be a resident is actually a non-resident. So there was a slight change in the numbers over the weekend based on the interview. And that will continue to happen as we continue to interview people and find out exactly their history and the location. So you saw a discrepancy there. Just wanted people to see that information. No new recovered cases, no new deaths, no new hospitalizations, and the governor spoke about the total cumulative cases. Going on to the next slide, you can see the locations of the cases today. I really appreciate Dr. Bernstein and Natasha Pineda being on to talk specifically about the Anchorage cases. Just wanted to provide a few more details before I move on about what we're seeing with the kind of clusters and investigation. We definitely see ongoing community spread in the Mat-Su, Anchorage, and Kenai region, particularly down in the South Kenai region. And as we're doing interviews, it appears to be that these seem to be linked, at least some of the cases, into some clusters relating to some large celebrations that happened, and then people coming back and mingling and mixing. A common theme is just the importance of really staying home when you're not feeling well and keeping your circles really small. It's impressive when we see this disease, how sneaky it can be, and it can really spread amongst larger groups of people, 20, 30, 40 people getting together for a celebration, spreading, and then people going to work sick, and then how it can spread from there. So it's really important that we keep those circles small and that we do what we can to really minimize the spread of this disease moving forward. We always knew that open never meant over, and as the governor mentioned, continue to be able to watch and see these cases. We have increasing testing capacity, and the quicker we can identify these cases, the better off we are, because we can kind of help minimize the spread and moving on and moving forward. I think more than anything, for each and every person who is diagnosed, as well as those who have family and friends in the long-term care facilities or transitional care facilities, thinking about them right now. And also the business owners and employees. There's a lot of uncertainty in today's world with everything moving and changing all at the same time. And I know many are kind of thinking about what their business structure looks like right now with people who have been diagnosed and close contacts associated with that. It can be a really tricky disease. You can have a husband who doesn't feel well, and then a wife who goes to work as a waitress and then serves someone who may work as a nurse in a long-term care facility. And it just kind of quietly spreads from one person to another. And part of the reason why we're just really asking everyone to have that small lift individually for a big collective lift together. So going through the rest of the slides here, a little bit more details in the breakout on ages. You continue to see a broad range of ages that are being diagnosed. And as mentioned previously, the 12 cases are associated with the long-term care facility, and Dr. Bernstein and Natasha are going to speak about that a specific case a little bit more. Moving on to the next, I just really want to remind people what the symptoms of COVID can look like. We're not in flu season right now, so if you're having new onset of symptoms, it's really important you get tested early. So somewhere between 83 to 99% of people have a fever. Many people, somewhere between 50 to 80% of people will have a cough. If you lose your sense of smell or taste, those are all signs of COVID. And it's really important that you get tested early, partially because your viral load is higher early on, and also so that you can prevent spread to your family, your loved ones, those that you work with, to be able to keep businesses open, friends and family healthy and active. So please get tested early if you're having any symptoms, and do not go to work, do not hang out with others if you're feeling at all off. We really want to diagnose this early so that we can keep it from spreading, so we can keep it from overwhelming our healthcare system. Moving on to the next slide, just a reminder that there's a lot of really great low-risk activities that you can do. And the higher risk activities, such as spending extended times near other people in close contact, the higher chance of this disease spreading. So enjoy your favorite restaurant, maybe as a takeout. Find ways to do the things that are important and meaningful to you, but with minimizing the risk. Again, if we each do a small part here and sacrifice a little bit, it will cause a lot less pain and death and COVID long term. So doing those parts now. So just going through the big parts that people know about. Again, wearing a mask. It's kind of like covering your nose and your mouth when you cough. Again, it's your nose and your mouth. The more we're learning about this disease, the more we really are concerned about transmission from people just speaking in a closed space together near each other. And so having that mask on, that facial covering on when you're in public can make a really big difference. This data is always emerging and we're learning new things about it, but continue to do our part. Again, it's not comfortable. I don't love wearing mine either, but by doing our little parts for each other, we can make a big difference collectively. And moving forward, the next two slides, again, the mask, and then just really keeping your distance. That's 6 feet apart, inside or outside, and the mask does not replace your distance. You want to make sure that you're doing both of those things together. Keeping those social circles small, the next slide, and then just moving on to the very end of the presentation. Just remembering that these small sacrifices that you make now can make a really big difference moving forward. So more details on the cases, I'll hand it over to Dr. Bernstein to talk a little bit more about the Anchorage, and then again, I'm always happy to answer any questions.
Thanks, Doctor. Dr. Bernstein?
Thank you very much, Dr. Zink and Governor. In addition to operating the largest hospital in the state, Providence has 5 skilled nursing level facilities throughout the state of Alaska, and the 2 are in the municipality of Anchorage. We've worked very hard. I'm very proud of the staff of these facilities. The virus has been in our community now for nearly 3 months, and we have not had any residents acquire COVID prior to a few days ago. And we did learn on Friday, late last week, 1 resident developed symptoms of fever and cough and turned positive Friday. And we worked closely with state officials, Dr. Zink and Natasha, who you'll hear from shortly, and the municipality, both departments of public health, to investigate. And over the weekend, all of the residents of these skilled nursing facilities, Providence Transitional Care and Providence Extended Care, have had testing. We've also completed testing of all the workers, we call them caregivers, who have worked at the facility as well. And we do know now that approximately 12 individuals are positive as a result of that testing. And we're grateful to the state and the municipality for helping us with public health nurses to complete the testing, and the state for running all those tests for us. Prior to this occurrence, these facilities worked diligently at their infection prevention protocols. We actually upgraded some rooms and created negative airflow in them for this possible occurrence. They were wearing appropriate PPE. We've been cleaning high-touch areas multiple times a day. We've had no visitation since mid-March in order to prevent something like this from happening. So now our work focuses on caring for the residents who are positive, most of whom, fortunately, do not have symptoms at this time. We are stepping up even closer our screening and surveillance of these and other residents to watch for additional early signs of the disease. All residents who have tested positive are remaining in their rooms so that the disease cannot spread further from them. And we continue to screen all the workers, caregivers, when they arrive for work every day. We were hoping we could prevent this from happening, but we know that this is a highly transmissible or contagious virus, and the real challenge is that people can be very infectious when they're asymptomatic or before their symptoms develop. We'll continue to work closely with our state and municipal colleagues to bring this infection under control and to prevent further spread. I want to just comment as well that over the same period of time, our hospital has increased capacity to care for patients infected with this virus, including those that would require intensive care or ventilation. So we really do feel that we have capacity to handle the increase in cases that we're seeing currently. So let me turn it back over to Governor Dunleavy.
Thanks, Doctor. We're going to go to questions now, and press may ask any one of us questions on the cases. But again, keep in mind that the caseload today is the highest it's been, 27. 10 of those, once again, were in a specific place in Anchorage, in a care facility. So again, with the exception of those 10, you'd have about 17 cases, which we've had a couple days throughout this pandemic in which we've hit 16, 17 cases, et cetera. So again, we're not. This is not. We're not having this press conference because we are overly concerned. This is our largest number so far, but we're in the process of understanding it. We've got the cases nailed down to specific locations, and in the case of the care facility, again, we know exactly who those individuals are and where that is taking place. And so again, we are confident that we have the ability to manage. We will see numbers again. Tomorrow numbers may be lower, numbers may be the same, they may be higher. But again, we're watching it. We're projecting out, and as of today, we still feel pretty good about where we're going with the state of Alaska. So with that, Jeff, if we can open it for questions, we'll take some.
Okay, thank you, Governor. We're going to begin tonight with Timothy Rocky at the Frontiersman.
Thank you, Jeff. There have been a number of large gatherings recently, including Memorial Day events, one of which you attended, Governor, at the Veterans Memorial Wall of Honor in Wasilla on Monday. Not many people were seen wearing masks. So with 27 cases today, how concerned are you that Alaskans may be feeling a false sense of security with the previous string of low numbers?
So certainly I think our low numbers might have some folks believing that this may be something that doesn't impact them, or it's not something that's going to affect them or their families. But the fact is, the virus is out there. We know it's here in Alaska. We know it's been in many cities and communities in Alaska. We've done a pretty good job of keeping it at bay. We're doing a pretty good job at testing, but we've always said the numbers are going to go up. As a matter of fact, when we first knew that the virus is coming to Alaska, we thought it would be coming in larger numbers. We talked about a potential tsunami, and we were concerned about overwhelming our healthcare system. That hasn't happened. We have no intention of allowing that to happen. And so again, it's the best way to prevent getting the virus, or I should say minimizing, because this is a pretty sneaky virus. It'll jump from person to person. There are people that don't even know they have the virus. They're asymptomatic, et cetera. And so it's a tough one because there's no vaccinations, as we talked about. So long story short, Tim, if you can avoid crowds, if you're going to be in a crowd and you're going to a supermarket, if you want to think of others, The concept of a mask, once again, the type of mask that the average Alaskan would wear or American would wear is not a mask that's going to prevent you from getting the virus, but it's going to help limit your coughs or your sneezes so that it helps others. Large gatherings, if you can avoid large gatherings, you avoid large gatherings. Same advisories we've been talking about for some time. They're basically the best practices we know that will help reduce the spread. But nonetheless, we've always said the numbers are going to go up, but we're pretty confident we're going to be able to manage those numbers.
And let's go to Margie Bauman at the Cordova Times.
Yes, thank you. This one's for the governor again. Are you having any additional talks with the seafood processors about their testing of seafood workers coming in from out of state? And how comfortable are you, Governor, at this point about keeping that virus out of the seafood processing industry, particularly in Cordova and the Bristol Bay region as these fisheries continue to open up this summer? Thank you.
Yeah, we think we have pretty good protocols, Margie. As you know, those protocols were worked on over some time with the industry, the various players in the industry, as well as the communities and the entities associated with those communities. In terms of confidence in keeping the virus out, well, we've done pretty good. We believe that we hope to continue to do well with this. But again, it's a virus. It's all over the world. The chances of Alaskans being infected, obviously, are there. It's happening. But right now, we see no reason to change what we're doing. We think we have pretty good protocols in place. We'll look at potential holes that we have on a daily basis in our approach. If we find holes, we'll try and fix those holes so that we make sure that we can cover everything we possibly can. But we're feeling pretty good. We'll continue to monitor things on a daily basis. Yesterday, some of us were on the phone at midnight, 1 a.m, talking about this. And so, again, as well as any place in this country, I think we're on it. I think we're going to do okay, but we'll watch it on a daily basis.
Governor, can I add one other comment about that?
Sure.
I just wanted to add that for people's awareness, almost all of the seafood processing cases that we have had so far have been people who are still in their quarantine. So they're not people who've been interacting with the community, but they are in quarantine, are being tested as a way to minimize the entrance into the processing and into the community. So I just want people to know that that's been a lot of work from the seafood processing industry to keep it out, and that's almost all of our seafood processing cases.
Thanks, Doc.
Okay, thank you, Doctor. Our next question comes from Michael Armstrong at the Homer News.
Yeah, thank you. Hi. This is Michael. I'm concerned about, we've had, I think, in the last 3 days since Thursday, 11 new cases in the Homer area. And that's Homer, Anchor Point, and Lower Kenai Peninsula. It's a little hard to tease out some of those numbers with all the others there. But so we're seeing increases down here on the Lower Kenai Peninsula. And I'm wondering, I guess this is for Dr. Zink, do you have any thoughts about what's going on there? Are you seeing clusters? We're hearing stories of, some of the outlying villages. There have been clusters of cases there. So what are your thoughts about what's going on down here? Thank you.
Yeah, no, I appreciate that question. So if a case comes from a community less than 1,000 people, it's just listed as the borough as a whole to protect that person's identity. If they come from a community more than 1,000 people, then that specific community is mentioned. Again, we do a history to try to figure out exactly where the person's residence is from, and there's been a little bit of moving. There's clearly more cases happening down in the Kenai Peninsula, particularly the South Kenai Peninsula, as mentioned right now. And it appears to be that a series of these, maybe not all, but quite a few of them appear to be related to a couple of celebrations that took place of kind of known people that knew each other, and the disease spread amongst known people between each other. We'll have to watch it over the next couple of weeks to try to really make sure that doesn't spread out from there and continue to escalate. It does also appear some of those South Kenai cases may be related to a couple of Anchorage and Eagle River cases. So we're really looking at these gatherings, other ways that people kind of cluster and get together, and the ways that the disease then spreads amongst those clusters. And that's what we're seeing in the South Kenai region right now.
Okay, thanks, Doctor. Our next question comes from Fairbanks. Aaron McGordy at the Fairbanks Daily News Miner.
Hi, thank you. This question was for the governor. You
earlier in this conference urged Alaskans to avoid large gatherings if possible. Why not re-implement a mandate limiting those gatherings as was previously in place if you don't think that Alaskans should be gathering in large numbers?
Yeah, because, Aaron, we have a society and an economy. We have a comprehensive approach to health and life that needs to continue. Again, this pandemic is a problem. It's persistent. That's why we're here today. But at the same time, the idea that we can stop the virus, eliminate the virus by hunkering down and closing everything down, it's our conclusion, I think the conclusion of most of those in the medical field, as well as policymakers, economists, et cetera, that's going to have more of a detrimental effect on society, more of a detrimental effect on the economy. And no, we're not putting the economy ahead of health, but they're intertwined. You can't divide the two out. They're related. Through this process over the last several months, we've gotten reports that individuals have put off their health care needs. For example, folks with diabetes, high blood pressure, heart issues, strokes, they were putting off seeing the doctors. That's not good. We don't want folks getting sick or passing away because of the virus, but not because they were infected, but because they didn't want to go out, they didn't want to go see a doctor. That's problematic as well. It's just as problematic. And so, again, we have to go back and remember what we talked about months ago with the people of Alaska. Under the early models, we thought we were going to be overwhelmed as a world, as a nation, as a state. Those models proved not to be accurate, thank God. Nonetheless, that virus is still here and is causing problems. But again, we're in a management phase. We'll continue to manage it. As we said, if we see something extraordinary, unusual, that health folks, myself and others believe is going to be problematic with regard to our healthcare capacity, then we'll deal with it and we'll stand before the cameras like we are today and say that there may be some changes here or there, but we don't see that at this point. And once again, if you take the 11 folks, the 10 or 11 folks that were localized in a facility here in Anchorage, you're looking at about 17 individuals. These are all manageable cases, and if you look at our hospitalizations and those that are recovered, we're still in pretty good shape.
All right, now let's go to Juneau and reporter Rasha McChesney at KTOO.
Thank you so much. My question is based specifically on, I'm looking at the state's epidemic curve and the graph that's available on the COVID-19 dashboard. And if you are looking at the confidence interval in that graph, we appear to have actually blown past it twice this week. And I'm just sort of curious if we're getting cases more rapidly than we expected that we were going to, and at what point, Governor Dunleavy, you would step in and consider changing or tweaking some of the mandates. If there's a hard number that you're looking for or a number of cases in a particular community, just kind of how fast do we have to be gaining cases before you decide to sort of change the trajectory that we're currently on? Thank you.
Yeah, great question. That'll be a discussion with our health folks, as it always has been. Again, keep in mind that when your numbers are, in many days, are 0, 1, 2, 3, a doubling of that, or going from 3 to 9, statistically speaking, may look to some to be significant. Again, we're looking at our healthcare capacity. We're looking at how many cases we can manage, how many will be hospitalized. We're looking at how many folks are tested, end up being asymptomatic, never have any symptoms, how many folks that are tested positive, do they get ill? Is it just slightly ill? They stay home for 2 weeks and then they recover. One case doesn't necessarily translate into a death or a long-term or ICU hospitalization. So again, we're looking at all the metrics, we're looking at all the numbers, we're looking at all the things we talked about, and we're having discussions every day. Like I said, we're up midnight, 1 o'clock in the morning, talking about this. And we'll continue to do so. But at this point, again, the number of cases at 27, a number of them being localized here in Anchorage in a facility, it's certainly something we want to look at. And if we start to see something that's persistent and keeps growing and growing and growing and growing, we'll certainly have a conversation. And there may be changes to recommendations and advisories. But we don't see that at this point, and we're going to keep watching it, and we'll, again, get before the cameras and talk about the cases that we see this week.
The last four questions.
Is that you, Dr. Zink?
That was me. Thanks, sir. I just wanted to make one other comment about confidence intervals specifically, because I get that question a lot. And how come the confidence intervals change, and how about the numbers and models and predictions? I think it's incredibly important to remember that when we have low numbers and we have a population that's very small compared to the rest of the United States, it becomes very hard to predict. And it's really important that we take all of these numbers into context and that we take them with a grain of salt. When we talk to the modelers in the US who are doing larger modeling, they will tell you that states that have large geographic regions and small populations, it's much harder to predict when and where you'll get cases and what happens, and why it's just really important that you test, use the same basic information, and you watch your numbers closely. So I just really want Alaskans to understand some of the limitations with the data and the numbers.
Thank you, Doctor.
That's really helpful. Thank you.
From Anchorage, let's start with Dave Laval at KTVA.
Thank you very much. This is for the governor. Governor, are there any plans to reconsider changes to the travel mandate you highlighted on Friday?
Not at this point. Again, this is Sunday. We'll continue to look at the numbers. We think we have a pretty good plan in terms of revisions to the 14-day quarantine with the testing. So not at this point, and if there is, we'll certainly let you know.
Thank you, sir.
Matt Lessman at KTUU.
Yes, thank you. My question is for the governor. You've said, you've made it clear that kind of today's upward trend in cases isn't a huge reason for alarm. And you've been saying all along that we're going to keep relying on science and data to make these decisions. Last week in a Must Read Alaska article, you were quoted as saying, we can't shut down again. I guess, does that mean if these increases in cases were to continue, shutting down even partially is something that's off the table at this point?
No, not necessarily. And the context in which that discussion was taking place is if we see something significant that healthcare officials, policymakers, others really see as problematic, and there's just no doubt about it, we'll make revisions. But the idea of just shutting down to try and eliminate as many cases as possible, that's something that we believe at this point is not necessarily good for the whole of Alaska, all of our health care, not just this virus, mental health, emotional health, you name it. And so we're going to watch it. There's never a never in this because it's always evolving. It's a fluid situation. But again, we're looking at our metrics. We're feeling pretty good. We've always said we'll see more cases. We thought we would see a tremendous number of cases in the beginning. And what we had were some very, very, very small numbers, sometimes no cases at all. And so, again, with that, there's never a never. We'll watch it every day, and we'll make the right decisions with Alaskans so that we can move forward in this phase of managing this virus. Without a vaccination, it makes it difficult to do anything but manage our situation through this. And that's what we're going to do using the best science, best numbers, and we'll come up with the best advisories and advice for folks. So that was our last question for tonight. Again, it's Sunday, and we'll continue to report on the numbers throughout this week. We'll also be having conversations about the revisions to the travel into state, and we'll continue to have discussions. Again, we want to have this press conference because the numbers are higher than they have been before, but at the same time, we wanted to be able to answer any questions. And just to let Alaskans know that from a policy standpoint, from discussions with our medical teams, we're going to keep an eye on this. We are not panicked. When I say we are not concerned, what I mean by that is we follow every number. We have discussions all the time. For example, when our numbers were 0, why is that? What's happening? When our numbers were 6, why is that? What's happening? Where are the numbers? Where are the cases occurring? How are they occurring? And so we knew that, again, the numbers will rise in Alaska just because of the nature of the virus. We know that the numbers will rise in Alaska because the advisories have been lifted across businesses, society, entities. And so this is not a shock. Again, we want to keep an eye on it. We start seeing a pretty steep incline here over a set period of time. We're certainly going to react to that. We'll have that discussion with Alaskans. But again, when we look at other states, when we look at what Alaska's done, We look at the numbers. We look at the inclines, the declines in other places. It is manageable. We will manage it. We'll continue to manage it, and we'll continue to have discussions with Alaskans. But as part of our policy to be as open and as transparent as possible and get the news to you as quickly as possible, we felt that it would be a good idea to have this press conference today. And so with that, we're going to conclude, but we'll continue to inform Alaskans. We'll take a look at the numbers again tonight and tomorrow, next day, day after, and continue to have the same discussions. So with that, thank you, and we'll talk to folks here this week.
All right, so that again was last night's press conference with the governor and other members of the administration and the press to discuss a sizable jump in the number of cases, although again, you can attribute a fair number of those to two specific cluster areas. And they should be providing new guidance tonight. Not guidance per se, but details on the plan for changing the mandatory quarantine for out-of-state travelers and how they're implementing testing as an alternative. Basically, it sounds like they're giving travelers a choice. They can be tested, and if they test, and that's 72 hours before you get on the plane, a maximum of 72 hours. If you test clean, you don't have to quarantine when you get here. If you don't test clean, I'm not sure that they'll even want you to get on the plane. If you object to being tested, if you consider that to be a civil rights issue or for whatever reason, then you can do the 14-day quarantine instead. But anybody that doesn't show up with test records can then choose to be tested once they arrive in the state. That's like if you lose your paperwork or something. Or, again, if they don't want to be tested, then do the 14-day quarantine. So there is still choice built in there. I know some people will argue it's, a crummy choice between two evils, but we'll leave that to the individuals to decide and just share the facts. One more reminder back here at home. The playgrounds reopened today. Use at your own risk. That's the Knoll Palace Children's Memorial Park, Mount Echols Playground. Be sure to wash hands before you go and wash hands after you leave. Bring your hand sanitizer and wipes. Don't expect those things to be available. Stay home if anybody's sick. Remember to social distance. Remember, if we end up having an outbreak as a result of playgrounds, that they'll have to shut them back down again, and you can get questions answered at 7282. And then finally, we'll remind you once more of the change to the drive-up testing schedule. Ilanka is still doing Monday and Wednesday, but it's now 1 to 3 instead of 2 to 4. CCMC is still doing Tuesday, Thursday, Friday, but they're going to mornings, 9 a.m. to 10 a.m. instead of 2 p.m. to 4 p.m. So 1 to 3 at Ilanka on Monday and Wednesday, 9 a.m. to 10 a.m. at CCMC, Tuesday, Thursday, and Friday. They would still appreciate it if you'd call ahead and pre-register. That saves you time, helps them keep things efficient. And again, if you just can't use those times, those prearranged times, you can call either facility and make arrangements to accommodate your schedule. And with that, we will close today's town meeting program. Don't forget, our briefings with the city officials will be coming up in the 1 p.m., 5 p.m., and 8 p.m. hours on the radio on KLAM and KCDV. This show and those briefings will be archived at youtube.com/Cordova TV, our repository for all things COVID, which, at least so far, has not been proven to be something you can catch over the radio. May it ever be so. May the odds ever be in our favor. Big thanks to Cordova Wireless Communications for the sponsorship. Can't do this without them. Your local cell phone provider that provides your local talk show. The rest of your 10 a.m. hour programming that was preempted will be brought to you next. And we will see you next time for your on-demand local talk program, Town Meeting on KLAM.